Hello, everyone. Welcome to Lump Basics. Let's start the ball rolling with the first presentation. Let's have Ma'am Needs You, certified acupuncturist from Silang, Cavite. Good afternoon po, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, classmates. Okay, topic for today is the entry and uh, exit points ulit, day 3. Okay. Blocks along the superficial energy circulation. So we have here a clinical example number 1, young backache following the cold exposure. Okay. The patient has a severe backache after sitting too long in the cold. He could hardly move. When treated with urinary bladder yang sedation, the pain did not improve. Remember, it improved when kidney yin was sedated with kidney 5. This is because the cold from exterior had increased the kidney yin, which blocked the energy flow, and then the energy in the urinary bladder could not pass through. Okay po, yun po. Tingnan niyo po yung diagram natin. Okay, yung may explanation sa susunod. This is like a traffic jam, which an obstacle in front of it. The black energy shows symptoms of yang excess as it is in a yang exterior meridian. But the pain does not respond to yang sedation. It responds to yin sedation of kidney, as removing the excess kidney yin will remove the block, and the energy in the urinary bladder meridian can then flow through, relieving the yang type backache. Okay po. Then we have here example number 2, holiday migraine or premenstrual migraine. So a patient, a young woman, suffers severe migraine headaches with shooting and pulsating pains. They always occurred on weekends, on holidays, or a few days before her periods. She had noticed that the headaches appeared gradually and rose to a high point over half day. If she exercised or went for a brisk walk at the time the migraine began, this could sometimes prevent the headache from worsening. This patient had a very young type of migraine. One would therefore expect this to occur because of excessive yang or a deficient yin. But the migraine started during the rest or at premenstrual times, which would be when the body holds on too much fluid and damp. This is a yin dominant situation. So my question, why does it cause a yang excess type migraine? So sa susunod pong slide yung explanation. So most migraine headaches are one-sided. It is the gallbladder meridian that runs forward and back several times, covering the side of the head. So there should be a yang excess in the gallbladder meridian at the time of migraine. And it comes on a time when the liver yin is higher than normal during hydration and premenstruation, when there is stagnation of blood and dump in the uterus. It is where the liver meridian covers this area in the perineum and the vertex. Yan nagkakaroon. The liver yang is high during stress and during breathing. And liver blood and yin grow during rest or on a holiday unless this is an activity holiday. Yan po. Doon siya nagiging active. Okay? Sa pag-holiday disease. So, another interesting observation is a yang headache that occurs in a yin situation does not respond to yang sedation. Yung kanina, yung sedation of gallbladder 38. It does, however, respond to yin sedation, which is the liver 2 sedation. Therefore, it is quite clear that this again is a traffic jam syndrome, parang traffic ng mga sasakyan. As the liver meridian, which is ahead of the gallbladder meridian on the organ clock, becomes full of yin or blood, it blocks the gallbladder meridian from flowing freely. The gallbladder meridian has excess, which is called the traffic jam, and being an exterior yang meridian, it shows yang excess symptoms. Okay, let's go to the treatment. The treatment involves removing the block by sedating the liver yin. Recurrence of the problem could be avoided by preventing the liver yin or blood from stagnating. So, kailangan wala yun. stagnation. This means that such patients should engage in physical activity like sports, etc. while on holiday, hindi yung ano lang, hayahay. And in pre-menstrual phase. And the liver function could be tonified with points UB18, the Bakshu points of the liver, and GB37, gallbladder 37, which is the low connecting point of the gallbladder. Okay po, tingnan nyo po yung remember po yung points ng treatment. Thank you very much, everyone, for your attention.
Thank you very much, Ma'am Needs. Next is tongue signs. Let's welcome Ma'am Teresita Sumile of Rizal. Good afternoon po, Ma'am Teresita.
Good afternoon, okay. Good afternoon, everyone. Now let's talk about tongue signs. First is cracked tongue. This is a sign of dryness in the interior. A dry and cracked tongue is often without any coating and sometimes could be red if there is heat, as illustrated below. The cracks could be all over or sometimes in the center line, as in red meridian or on the sides in the liver, showing yin deficiency in these meridians. Okay. Next is rough tongue with red papillae. Often, the red papillae appear on a normal colored or even a pale tongue, as illustrated again below. Then it takes longer time for papillae to form than for the tongue color to change. So this shows a chronic heat state with a yin deficiency. It is common in chronic dry cough with night sweating and afternoon fever in chronic insomnia. A tongue that is extremely rough but without red papillae shows yin and blood deficiency without heat. Okay? Next is deviated tongue. A common symptom on hemiplegia or in facial paralysis, many patients who are not paralyzed also shows deviated tongues. The reason, however, is the same as in these patients. They have more muscle tension on one side of the body than the other. This means that the liver yang is higher on one side of the body than the other side. Since the liver meridian should have the same quantity of energy in the either side of the body, this symptom could only mean that the energy is not flowing from one to the other liver meridian because the wind is caused a block in this flow. Okay? Next is tongue coating. The tongue coating indicates the various climatic pathogenic factors that are attacking the body from the exterior. The coating indicates that pathogenic factors have been attacking the body for a relatively short time and can be easily eliminated. However, the tongue form and color shows the deeper state of blood, energy, and fluid in the body, and long-term, more serious imbalances. The pathogenic factors here are more in the interior and need dietary, internal medicine, and lifestyle changes and others to bring about fundamental cure. Okay? Now we have here differentiation of tongue coating, the thin, thick, slimy, and dry. Thin gives an appearance of slight roughness to the tongue surface and is generally a normal coating unless in the presence of upper respiratory tract symptoms when it could indicate the presence of wind pathogenic factor. Next is thick tongue coating. This is a thick layer of the carpet floor-like coating, which shows that the organs are in standstill, retaining food or stool that needs to be moved down or to be eliminated. This retention can be removed either by improving the function in coldness, or by sedating the young in heat. Next is slimy tongue coating. This is a glossy mucus-like coating which usually sticks to the palate and indicates the presence of dampness attacking the body. When it is white in color, this dampness could be treated with heat in young tonification. When the coating is yellow, this damp heat needs young sedation. So use points stomach 40 and spleen 9, and avoiding damp producing foods will help. Then the last is dry tongue coating. This is a dry and thin coating, making the tongue look quite dehydrated. When this is severe, it could cause peeling of coating, with islands of peeled coating areas appearing on the tongue. This could be a sign of climatic dryness and also that the patient drinks too little water. To humidify the rooms and to drink water will help. Tonification of yin of the specific organ according to the area would be useful too. Thank you so much for your attention.
Thank you, Ma'am Teresita. Next is needling techniques, part 13. Let's welcome Ma'am Mildred Digma, certified acupuncturist from Apayao. Good afternoon, Ma'am Mildred.
Good afternoon po muli. So, needling techniques number 14 na po tayo. Electrical stimulation of needles. So, this is a treatment, sabi ng author nito, that was invented in China in early 1960s. So, 1960s pa, matagal na po, ano. Sabi niya, naalala niya na trying out various electrical circuit using a few batteries and wires connected to needles sa kanya daw pong katawan nung siya ay student pa sa China. At siya din po ay nag-participate sa initial trials of providing acupuncture analgesia in surgery. So yun, needle lang yung ginamit sa pag-koopera. In the second military medical hospital in Shanghai. So these trials were not always successful, but it's experience po ng ating author. And today's experience and wisdom is based on many sacrifices on the part of the medical staff and the patient of yesterday's China. So yung mga karanasan ng China, yun yung nagpapaunlad ng acupuncture din, sabi nitong ating author. So electrical stimulation is a labor-saving way of stimulating many needles, at least 4 per treatment. Simultaneously, and the time period of an acupuncture treatment. Example po dito ay 20 minutes. Yan. So, it is easy and simple to attach the needle to an electrical stimulator. Ikakabit mo lang naman po yun eh. And select the frequency and intensity of the stimulation. And let the patient control the machine. A standard electrical stimulator provides 3 different frequencies. Yung lakas po ng energy na pumapasok sa katawan. So ito yung continuous frequency po So this is a frequency with equal peaks and intervals. So it can be regulated to. Pag slow po, 5 to 10 Hz lang. So po yun. Pag fast, 5 to 100 Hz. Pag very rapid, 1,000 to 2,000 Hz. So, ibig po sabihin, the slower frequency is more similar to continuous manual agitation of the needle. Yung parang lang ng kamay, tayong gumagalaw. Which is similar to the sedation technique. Nagsisedate ka lang pag slow. Pag rapid stimulation po ay ina-apply, ito, ginagamit na po ito sa mga analgesia, yung pag may mga surgery. Basically, the faster frequency, the better pain relief. Yan, pag mas mabilis, so wala siyang pain na nararamdaman. The slower continuous frequency is what we commonly use in the treatment of musculoskeletal pain. So slower po yung ginagamit natin pag may mga pain lang sa mga muscle or mga part ng katawan. It is very effective in hot pains. So mas ginagamit natin ito yung may mga heat symptoms. Kasi nagsisedate tayo eh. That is pain that worsen during activity or sports or in inflammation or injury. Whether possible, the needles are given in the painful area. But in the case of inflammation, it is also possible to needle above and below the pain and connect the circuit through the inflamed area. So parang acupoint ang gagamitin po natin. Pwede kang gumamit ng acupoint lang. Then, lagyan mo na nung ano natin, pang electroacupuncture. Ayan po, nakita natin ano. So the figure shows to the meridian passing through an inflamed or hot pain area. The needles are placed on either side of the area on the meridian. So these points need not to be acupuncture points. Yung sinasabi, kahit hindi po acupuncture points, pwede kang mag-needle basta't nasa meridian siya. Pero may tamang lalim po yan ha. May tamang lalim kung gaano mo dapat itusok. So are placed on the same meridian, one above and one below the inflammation. So acupoint pa, parang pinalibutan mo kung saan may mga pamamaga. Thus, when the machine is switched on, the circuit will pass through the affected area and disperse. Yun po. A continuous frequency of 5 to 10 Hz is used for 20 minutes. And electroacupuncture, yung ginagawa niya, i-disperse niya yung mga stagnation dyan na causes ng mga pamamaga. So, acupoint po yung ginamit. So, thank you po. Masarap po gamitin yun.
Yeah. Ramdam ko na gustong-gusto niyo, Ma'am Mild. Okay, let's go to the fourth.
Yes, Doc, naka-experience po kami yung nag-opera ng katarata.
Oh.
Yan. Dalawang nida lang po, large intestine 4. Kaya niyang opera
continuous,
na talaga.
no? Parang
Opo.
hindi siya nasasaktan. Okay.
Opo.
Maraming salamat. Let's now proceed to the next topic, diseases and symptoms of the earth element. And let's welcome once again Ma'am Teresita Sumile for the presentation. Good afternoon po ulit, Ma'am Teresita.
Yes po, Doc. Good afternoon ulit and good afternoon, everyone. We are still on diseases and symptoms of earth element. And now let's talk about abdominal pain. It is common for patients to come to the doctor with stomach pain. We accept what the patient tells us and proceed on a line of questioning based on the understanding that it is a stomach pain that the patient suffers from. After 15 minutes, we have diagnosed the problem with the stomach, and just before setting the needles in, we ask the patient to point out the painful area, only to find out that he or she is pointing to their lower abdomen. That is 15 minutes wasted, and there is no more time to ask any further questions. It is always a good idea to ask the patient to point out the area of pain exactly at the first few minutes of the consultation. If the patient is in doubt or shows you a large area, then it is necessary to palpate this area to find the exact location of the pain. The author have noted that doctors and therapists tend to sit back and ask the patient many questions and do not always seem to know what to make of the answers they are given. This attitude may be because they seem to feel that acupuncture is complementary therapy and one should ask all these questions. But the answers do not do not really matter. One could always give book points, okay? The author have listed some questions here and what the answer should convey to us. The first question is, where exactly is your pain? Please point it out to me. An abdominal pain can manifest in different areas that suggest different organs are affected. For example, the patient points the pain on the upper right part of the stomach. So the liver or gallbladder area is the cause of the pain. And if the patient points out on the lower right portion of the abdomen, it is a small intestine area is affected. Then, if the patient points the pain on the left upper part of the abdomen, so it is on the stomach area. And on the lower part of the left side of the abdomen, it is on the large intestine area. So it is specific now, okay? Then the next question is, how does the pain feel? Is it constant or intermittent? What brings it on? What makes it better or worse? These questions tell us if it is a yin or yang dominant pain. A yin dominant pain is dull and constant, worse with fatty foods, cold or raw foods and drinks, worse after meals than when hungry, worse at nights and in rest, and improves with the opposite factors. A yang dominant pain is severe and intermittent or colicky, worse with strong flavored foods, alcohol, caffeinated drinks, worse when hungry and better after bland food, worse in stress, activity, and in the day. Now this next question is, how long have you had this pain? Does it come on during a particular time or day? This should help you categorize the energy situation into the acute, chronic, and subacute recurrent states. And then you can decide whether to tonify or sedate accordingly. Asking for a particular time the pain occurs, this could be its maximum or minimum energy time of the organ. This guides us towards the decision to tonify or to sedate. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. That was very helpful indeed. Let's now call on Ma'am Lynn Galarita of Quezon City to continue her discussion of the general principles of acupuncture treatment. Good afternoon, Ma'am Lynn.
Good afternoon, Dr. Hector. Good afternoon, everyone. We're on our fourth part of the general principles of acupuncture treatment. For today, we'll talk about the other factors that we need to consider in our acupuncture treatment. And one of that is climatic and seasonal conditions. In spring, pathogenic factors are most likely to attack superficial layer. In summer, the skin layer. In autumn, it will reach the muscles, and in winter, the tendons and the bones. So in our treatment, during summer and spring, acupuncture would be shallow, or needling shall be done in shallow manner, for the pathogenic factors are only in the superficial layer. During autumn and winter, we will have to do deep acupuncture as the pathogenic factors involve the muscles and tendons and the bones. For geographical locations, in the north, in the highlands and mountains exposed to bitter wind and severe cold, people there prefer outdoor dwelling and milk. Thus, they are susceptible to gastric distension due to accumulation of cold, for which moxa is advisable. That is why, as they said, moxibustion originated in the northern part of China. In the south, where it is damp, foggy, dewy, people there prefer sour taste and preserved food. have tight muscles and red skin. And the people are susceptible to cramps of tendons and rheumatism, for which acupuncture is advisable. And that is why acupuncture originated in the southern part of China. In individual conditions, women who have menstruation, pregnancy, puerperal problems, points should be carefully selected when treatment is given. People of different ages differ in physiology and pathology. So they will have to be treated differently also. As for constitution, there are people who are strong, weak. There are people with more heat and more cold. So the treatment principle should also vary upon the constitution of the patient. Middle-aged strong person with sufficient qi and blood, hard skin, if being attacked by pathogenic factors, may be treated with deep needling and needle retained for some time. Okay. In infant who has weak muscles and less volume of blood and qi, acupuncture treatment twice a day will be shallow needling and weak stimulation. As Ma'am Mildred earlier had shared, pagka-insert, pwedeng tanggalin na kaagad pagka mga babies. In physical laborers who usually has a high tolerance for pain, deep needling with needle retained for sometimes can be employed. For mental workers, there will be slow insertion of needle. So for the treatment process, the initial evaluation may take up to 60 minutes or an hour. Subsequent appointments usually take about half an hour. A common treatment plan for a single complaint would typically involve 1 or 2 treatments a week. Number of treatments will depend on condition being treated and severity, but 6 to 8 treatments are common. For complex or long-standing chronic conditions, 1 to 2 treatments per week for several months may be recommended. For acute problems, usually fewer visits are required, usually 8 to 10 visits in total. Among the contraindications are if the patient has a bleeding disorder or has a pacemaker and the patient is pregnant. And there are specific acupuncture points contraindicated for pregnancy. Okay. And that caps our discussion on the general principles of acupuncture treatment. Thank you for listening.
Thank you very much, Ma'am Lynn. That was very, very, very informative. Now let's call once again Ma'am Needs You, certified acupuncturist from Silang Cavite, to continue her discussion of the controlling cycle.
Good afternoon, Doc Hector. Good afternoon, everyone. Dito pa rin po tayo sa topic natin, controlling cycle. Okay? Example nito. Kidney yin fails to control the yang of fire. This shows that a yin deficiency in a yin organ may be the cause of an uncontrolled yang in the grandson organ, as it depends on the grandmother organ for its yin. Okay, andyan po may diagram po dyan. Na-discuss po natin yan before. But it applies to all the other organs as well. So, kita nyo po yung yang, yung kidney ay, yung water ay kinontrol yung heart or the fire. Okay po. The explanation po the other side. The other, Pero clinical example muna tayo. Patient, 37 years old, male. This man suffered from recurring burning pain and acid reflux from the stomach. So, yung kanina. He was thin and often felt hungry. His pain appeared when he was hungry and disappeared after he had eaten some bland food. He was a very tense and nervous person, getting easily angry and losing his temper when he was hungry and he was in pain. So, kita nyo yung wood, nagre-react, kinokontrol niya yung earth or yung spleen. Okay? Ito po explanation. On the other side, ito po sa isang slide, sunod, explanation yan. This is a case where the liver yin is deficient and cannot control the stomach yang. Okay? The stomach yang can rise easily because there is not enough yin in the stomach or in the liver to send to the stomach. So if there were no liver symptoms, then we could have balanced only the earth element. With point stomach 42, sedation, which is the yuan source point, and spleen 21, tonification, which is the low connecting point. As the liver is also involved, we could note from the symptoms, we need to tonify the liver yin as well, preferably with the house element point liver 1. It is also important to advise the patient to eat more protein, cheese, and milk products so that the emptying time of the stomach is delayed. So yung po, pag-aralan na lang po natin yung drawing kanina, okay? Yung po example niyan. Thank you po, Doc Hector. Thank you everyone for listening.
Thank you very much, Ma'am Needs. Up next is meridian theory. And we shall call once again Ma'am Lynn Gadarita for the presentation. Good afternoon po ulit, Ma'am.
Good afternoon ulit. So for today, let's continue our discussion on the triple warmer meridian of hand lesser yang. Yesterday, we left off the discussion at triple warmer 4. So today, we'll start with triple warmer 5. Its location is Tushun, proximal to the dorsal wrist joint space or the dorsal wrist crease between the radius and the ulna. Triple warmer 5 is the luwu connecting point of the triple warmer. On the opposite side of this point is pericardium 6. These are both the luwu connecting points. The triple warmer 5 is used to assist extension movement of the wrists and fingers, while pericardium 6 is used for contraction of wrist and fingers. Both triple warmer 3 and triple warmer 5 are commonly used in the treatment of deafness. Triple warmer 5, especially for blocked feeling in the ears. Being the low connecting point of a yang meridian, it has the ability to sedate the yin and increase the yang at the same time. Next is triple warmer 6. It is located Trijun, proximal to the dorsal wrist joint space or the dorsal wrist crease, in a depression between the radius and the ulna, radial to the tendon of the extensor digitorum communis muscle. It is a symptomatic point for constipation. It's also used against acute side headache or neck pain with sedation. This is the fire point and the house element point of the meridian, and therefore it can be used for tonification and sedation. Next is triple warmer 7. It is located Trijun, proximal to the dorsal wrist joint space, and 0.5 Sun ulnar to the center of the forearm, closer to the ulnar border. It is the sick left point used in acute ear infection or deafness because of the proximity of the meridian to the ear. In children with ear infections, kidney sedation is contraindicated, and thus triple warmer 7 is the point of choice. Triple warmer 6 and triple warmer 8 are used with sedation when there is acute pain in the gallbladder meridian. Since both meridians have the same polarity of energy, sedating one meridian works for the other. Also, a triple warmer is the sun organ of the gallbladder. Sedating the sun causes sedation of the mother organ too. Triple warmer 8. It is fortune proximal to the dorsal wrist joint space between the radius and the ulna. Radial to the tendon of the extensor digitorum communis muscle. It's an excellent point in the thoracic pain on the side and flanks. Triple warmer 10 is on the lateral aspect of the upper arm with the elbow flexed at a right angle. The point is located in a depression approximately 1 tun proximal to the olecranon. The sedation point and the earth point of the meridian. Sedating triple warmer is one way to sedate the yang of the meridian mainly, and also for sedating the yang of the fire element and that of the entire body. And that's all for today. Thank you for listening.
Thank you very much, Ma'am Lynn. That was very helpful. Let's now proceed to the last presentation. We're still on chest painful obstruction syndrome. And this time we talk about the Western differential diagnosis. From a Western medical point of view, the causes of chest pain are classified into 3 categories: myocardial infarction and causes other than MI, like pain of cardiopulmonary origin and pain of non-cardiopulmonary origin. Such differential diagnosis is essential for early recognition of the most severe and potentially life-threatening conditions. So here we have a differentiation of the chest pain. Like for the heart, you'll have to consider familiarizing with IHD or ischemic heart disease, stable angina or unstable angina, myocardial infarction, aortic dissection. For the lungs, pulmonary embolism, pneumonia or pleurisy, pneumothorax, and lung carcinoma. For the esophagus, we have hiatus hernia and gastroesophageal reflux disease or GERD, and carcinoma of the esophagus. Now let's talk about ischemic heart disease. Myocardial ischemia occurs when the myocardium receives insufficient oxygen due to inadequate blood supply. This is the result of an imbalance between oxygen delivery and consumption, with a fall in the oxygen delivery and increase in consumption. So there will be shortage of the oxygen, myocardial oxygen. The most common cause of myocardial ischemia is atherosclerosis, coronary artery disease. Plaques or atheromas build up on our artery walls and obviously will restrict blood flow. Conditions causing chest pain other than the atherosclerosis are aortic stenosis, arterial hypertension, tachycardia, coronary spasm, embolism, or dissection of the coronary artery. Ischemia of prolonged duration induces MI. A 20-minute ischemic time may result in an irreversible myocardial injury. So that means you will cause death of the cardiomyocytes. No? So there is really a need to have frequent or maintenance treatment using acupuncture. Angina pectoris, or simply angina, is a type of chest pain caused by ischemia. Typical symptoms are retrosternal pain, the so-called Levine's sign. The patient makes a fist and holds it up to his chest to describe the pain. Its radiation to the ulnar side of the left upper extremity, a feeling of constriction and chest oppression. However, pain can also radiate to the right arm, both arms, shoulders, neck, jaw, and upper abdomen. Nausea and vomiting may be associated. Signs of adrenergic activation are observed and include sweating, skin pallor, and restlessness. Risk factors for atherosclerosis are sex, higher prevalence in male subjects, the age, active and even passive smoking, elevated blood pressure, dyslipidemia, which means high levels of cholesterol and or triglycerides in the blood, diabetes, obesity, lack of exercise, and familiarity. Patients affected by this disease are classified into two main groups: subjects with chronic stable angina in terms of chest pain, and subjects with acute coronary syndrome, which is in turn divided into unstable angina and MI with or without ECG alterations. That means the ST segment elevation. Thank you very much for your joining us today, and we hope to see you in our next presentation. Thank you everyone for joining. Good afternoon.